Hey, great Thursday evening. It is a beautiful evening in the city of Brownsville. It was actually not as hot a day as most days have come out, but yeah, it was all right. And it was a very, very eventful day. And, there's a lot of stuff that I'd love to talk about, but like we have been mentioning, we do have Dr. Ed Hernandez here with us tonight. And there are so many questions that I know folks have for Dr. Hernandez that, we might leave the Sylvia Atkinson thing all the way to the end. But if we can't get to it tonight, guys, because of we have Dr. Ed Hernandez with us. If we can't get to it tonight, we'll get to it in the morning. But I think that a lot of individuals are very interested in regards to what happened today in court. Again, it was the coffee of the morning. Era el cafecito de la mañana. Todos estábamos esperanzando a ver qué es lo que iba a suceder con Sylvia. But again, guys, hey, Papa. We'll try to get to it at the end of the program, so we will touch all the medical questions and all the other information in regards to what went on over there in, with these doctors, which is something that I'm glad that Dr. Hernandez will be able to explain to us. We'll talk about current events to some extent. Before we go into the medical field, there's something that I just received that I'm very, very concerned with. One of the things that came out yesterday in one of the meetings at the district for my employees out there was, the superintendent was a little bit irate because, he said, if he could go to work, then everybody out there can go to work. He's an essential, and he was coming to work every single day. So, like, he goes to work, everyone else could go to work. So, again, he's pushing the narrative for everyone to go onto campus. Teachers, counselors, and everyone else. And I know that they're saying, well, it's voluntary, blah, 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 blah. I'm sorry. I don't believe them. Personally, I do not believe anything. They are rude, as everyone here could agree. They are crude. They have no class. And I doubt most of everything that comes out of their mouth. Well, in regards to special services, the individuals that take care of our special needs children, our special needs children. This is the protection that my people at special services have for them to go back to work. This is the protection that our staff people, our staff members who take care of our most vulnerable children in the district, this is the protection a $600 million organization, a $600 million budget organization is providing for our staff. Frankie, did you have a chance to see the picture?
You've been
talking about special ed, Frankie. What?
It's very scary, Erasmo. Whenever we see something like this, the district is very adamant on going back to school. We could ask Dr. Ed Hernandez. He has time and time again told us how it is still not safe for our students to go back into class. We have seen the rise, the spike in numbers here in the Rio Grande Valley. Deaths have been very alarming as of late. We see here how these cubicles, are being designed for our special services, our special population. It's not safe. Our special needs students, sometimes they act out, they lash out. We're putting our students and our teachers in harm's way. Don't think that by having these cubicles, it is going to be safe.
These cubicles are for our staff. Our staff that take care of our students.
Right, but we could ask Dr. Ed Hernandez right now, is this safe? And it's not, because the particles in the air are going to go through and possibly contaminate or infect the staff members. So, what do we expect? Are we going to give them hazard suits? Are we going to give them those N95 masks for all special services? It's too early in the game to be sending them back after the 4 weeks. And by looking at this is very alarming. This is something that is unacceptable. We should be worrying about the safety and well-being of students and staff members. And this does not cut it for me. We should be waiting until January. Let's assess the situation in January and then give us a better idea of what we're dealing with. But having these cubicles, this isn't the right thing. And our teachers are at special services are very worried. They're reaching out to us and they're saying, hey guys, make this public. Let this be known. And this is unacceptable. And I hope that with us coming together and being vocal about it, we can make the superintendent, which obviously he's not listening, make him aware how our teachers, how our staff is feeling about this. But this is a disgrace, in my opinion, guys.
Well, let me tell you again. This is our special services staff, folks, and no one. I don't care who they are. Not our custodians, not our food service people, not our bus drivers, not our teachers, not our counselors, not our teachers. No one should be neglected. And is this the utmost protection that we could grant to our individuals out there? And I'm going to ask Dr. Eder Hernandez. Dr. Eder Hernandez, again, has been at the forefront. One of the first medical professionals here in the city of Brownsville, who has actually, been a pioneer for the testing, for the treatment of our citizens, of our children. Dr. Eder Hernandez, does this protect our people out there?
So this is the first time I take a peek at a picture like this. This is questionable. If there's an affected individual, those particles could travel anywhere from 6 to 8 feet, and I commend the city for kind of moving on that 8 feet. Just recently, just changing that. But those particles are respiratory droplets, and they could easily come over that system. It all comes down to ventilation. There's some new recommendations that I would like to give the superintendent. As you know, we came on Dr. Saavedra. She's a DO and an excellent friend and physician. She came on board and tried to talk to the board, and it was something very quick and dry. We were not really could express. I couldn't hear them. The only thing I could hear was them ask me for my credentials. I think my credentials speak for themselves. I've seen thousands of their employees, thousands. Okay, and I've been in this community over 13 years providing quality care. So he knows exactly who he's talking to. The reality is the following: that is not a safe environment. The particles could easily come over. Those they look like shower curtains. I think it's questionable and it needs to be addressed. Now, there's some new technology out there that you can actually put in the vent system an actual UVC light to kill all the viruses and bacteria and organisms. So the ventilation is key for success for the children to be safe. And until that's proven of what they can actually do with the ventilation system, that is a big part of how do you go back to back to school with the ventilation. How do you address it? How do you make clean, purified air for the children? Because 1 out of every 20 is going to be infected. The community spread is very high. And at one time when I spoke with the health authority here, he mentioned that 1 out of every 20 is possibly infected.
Gosh, goodness gracious. 1 out of every 20?
Those are his words. It was possible. This was months back, maybe 2 months. We talk every now and then. We get very busy. We've now surpassed our testing side. 11,000 folks out there at Sports Park, and we've surpassed 2,200 infections that we've treated. And thank God, glory be to God, we haven't had one death from our efforts. We're very, very proud to say that we've been on the cutting edge, and we've been very proactive, very aggressive in the sense of against COVID-19. COVID-19 is not something to be called a hoax. It's taking people's lives, and I want to take this time to say a condolences to the Marco Trevino family. Marco Trevino and I grew up together. Marco is an excellent human being. He's the assistant director for the federal halfway house in GeoCare. Shout outs to those. I've been there. I've been the primary care for that group for some time, for some years now. I see all those inmates. And Marco's an excellent human being, and his parents were patients. You know, his mother was a patient of mine. His father was a patient of mine. Those two were lovebirds. You know, they were always together. He always was, I mean, he's just an excellent guy. You know, they're great people.
100%.
But for this virus to come and take their life back to back within 48 hours, it's serious, folks. It's a serious matter, and we want to offer condolences to that family. They're hurting. To Monica, to Erica, and to Marco and their families. To Myra Cortez, to the BISD family, because he was an educator for over 40 years. He spent his life teaching and cultivating. And for this virus to come and take his life, we have to be very cognizant. And this man, when I would see him, he always looked 10 years younger.
Yeah.
He looked in great shape.
Yes.
He looked 10 years younger all the time.
An amazing man, an amazing addition to our community in regards to everything that they implanted in our thousands of students that they, came into contact with. Dr. Eder, can air purifiers combat the COVID-19? I think you were mentioning something in regards to some purification system, like for our special services individuals that, have these little shower curtains, protecting them.
So you know that you're at higher risk for complications. And when you look at a pediatric population, the actual population that's at risk, it's going to be your diabetes type 1 children. How many children do we have in BISD that are on insulin? We have to look at those folks, okay? Type 1, and there's actually type 2, lots of type 2 now because of the obesity. Then the second individuals that we would be concerned about would be neurological. How many kids do we have that have Down syndrome, that have cerebral palsy, that have seizures? These kids are actually looked at as being high risk. So what is this district going to do to mitigate these kids, their exposure, and to provide relief because they're at higher risk? So some of the cool things, like this bag that I have here, this is a UVC bag. This bag has ultraviolet UVC. It kills coronavirus. This is what I do personally. I put my actual P100 respirator on here, and I purify my mask. This is my respirator. This is what I use. Okay, this guy right here. It really helps. So that technology can be integrated, okay, to the air duct system. As the air passes through, it could actually purify the air. So we need to ask and request, and parents need to ask for these things to be installed in every facility so people can have purified clean air, because the virus is spreading through, I truly believe the virus is spreading through ventilation systems. There are so many people that I talk to that are new infections. They don't know how they got infected, guys. They just mentioned they went to HEB, Walmart, and they're in the community, and they're being careful. They're wearing gloves. They're wearing masks. It must be a ventilation issue, and I think there's questions now on the ventilation spread.
Doctor, our special needs population is used to having a sort of routine, and they're used to having face-to-face instruction. Based on these numbers and these shower curtains that we see, is it in their best interest of parents and their children to go back to those schools, to those brick and mortars with those shower curtains?
So at the end of the day, the taxpayer and the parents, there's two sides to it. The parent, as a parent, you want to put your child in an environment that's going to be safe, productive, where they're going to enrich and they're going to grow mentally, and they're going to be, have PE, and have, obviously, they're going to grow as individuals, grow academically. Unfortunately, with this pandemic, this is new. This is new to the administrators. This is new to BISD. This is new to everyone. But what is not new is that the virus spreads easily, that we need to decontaminate surfaces. We need to think of strategies, but they have to involve local experts. They have to involve local experts. They have to involve local experts for them to give an opinion on how things could be done as a at best practices, right, to mitigate the disease and the spread. If a school opens up too early, they can cause serious harm to the community, where there could be multiple community spread infections from one source. Kids carry the virus as asymptomatic carriers, but they can take it home and spread it to the grandmother, or spread it to the mother that has diabetes, or to the custodian that has other autoimmune conditions. So it's in high question. When do we go back, and what measures have we taken? The UV light system in the air conditioner it's a must. People need to do the emails, do a signature log, and request for them to have purified air. Purified air, okay? Ventilation systems are very important.
Let me tell you, Dr. Hernandez, one of the things that I've been seeing for months now, and it's something I've been calling out for weeks. I have concerns, and I'm glad you brought out the buildings. I have had concerns for a while because I was starting to see the great number of individuals who had tested positive, like that worked for Cameron County, and that were all encerrados en un building. We saw the individuals that were going back onto campus estaban encerrados en un building. We know of the individuals that were at the PI center, the detention center. We know of the Carrizales jail with, I don't know, 600-700 positives already, the nursing homes. And I was telling folks, guys, it's something about the buildings, something about the ventilation system, something about the air that's recycled that we're blowing in, taking back in, the air particles. And then, like, it seems like everything is falling into place and saying exactly the right thing. So again, I'm going to repeat what I've been saying for weeks now. No one, not one custodian, not one food nutrition service, not one secretary staff, not one paraprofessional, not a counselor, not an administrator. No one should be going back onto the buildings until we disseminate all this data, Dr. Hernandez. No one. No. Every single life out there is precious. Every single life.
Every life matters. And
every life matters.
My mom's worked in food service at BISD for 18 years. Okay. My dad was a bus driver with BISD for many, many, many years. So the reality is everyone is equal, and the children deserve a safe environment, but the employees and the staff deserve the same. They're human beings.
So UV lights do great works in ACs. That's correct, right, sir?
Sure. Yeah. So the UV light it helps so much with within 20 to 30 seconds you could decontaminate the mask. So that's what I do with my mask. I have my own UVC lights that I use just to disinfect. They can be harmful to the eyes and can cause cancer if you look at, if you put it on your skin. So there's special devices that are formulated for UVC lights. But there's some hospitals around the country that use this type of sterilization and sanitation process. So there's so many things that we believe need to happen before people can come back.
Oh my gosh. Dr. Hernandez, I just received information in regards to, some concerns, something that goes with cat questions. Erasmo, we received our face mask, our PPE. I think horrible quality and not safe at all. It's all about the money. Dr. Hernandez, do you think that the masks that BISD is providing for teachers and staff are effective to prevent COVID-19? Have you seen them, Doctor?
I haven't seen them, so I think we need to analyze what type of mask it is. Is it a surgical mask? Is it N95? This is a P100 respirator. This guy here, it blocks 100, almost 99.9% of all pathogens, viruses, bacteria, and so this is an actual respirator. But regular surgical masks obviously do not do the trick. They prevents the spread, but it depends on the mask and an N95 particular. And then it also depends, are you fitted for your mask? You could have a mask that doesn't fit properly, and you're gonna take that air in that could be technically infected.
Dr. Hernandez, I actually have here with me a picture of the mask. And in your expert opinion, is this a high quality mask that will protect our staff, our personnel, our students? for a $600 million a year budget district?
Unfortunately, this looks like a possible cloth mask, and these do not filter or function or prevent, in my opinion, because I don't know the actual the quality or the actual kinetics on these masks. It doesn't look like it is a particular with any surgical mask. It should be a minimum of a surgical mask.
Well,
These cloth-based issues are problematic.
well, let me tell you, I received one of these masks. Let me tell you, doctor, um, they're not safe at all. I mean, I think I've bought safer masks aquí downtown at the dollar store than this mask that was provided by the district. Aquí con los chinitos, where the
I re-
virus started.
I recommend that every individual try to get themselves a surgical mask. They do sell them at HEB. I think you guys need to be smart. If they're providing you this mask, take the extra step and wear your surgical mask that's out there. You could buy that HEB and then put this on top of it if possible, because this doesn't seem like is anything that would be appropriate.
Going back very quickly to those shower curtains. Just to clarify, yes, Erasmo's correct. They are in the offices, but the teachers, they're not so lucky. They're sitting ducks. And are we going to be able to tell our parents, our community, that we are going to be abiding by the social distancing guidelines of the CDC in the classroom? And we have to understand that, our special needs population, sometimes they spit, they bite, they scratch the teachers. Sometimes, they have private nurses coming in and out that sometimes they have to feed, restrain our students when needed. So we're also putting our teachers at risk potentially. So again, these shower curtains in the office, I guess they could be great, but we just heard from the doctor how the particles they'll still go through them. So again, it's very scary, doctor, that the school district anticipates after the 4 weeks of distant learning that the students will eventually come back to the classroom. And going back to the disinfecting, sir, could you very quickly clarify the UV? Is it a constant disinfecting, or is it a one-time matter that happens maybe daily?
So the UVC could be turned on, and you can sterilize 300 to 400 square feet, a possible classroom within 15 minutes. So that's something that needs to be done without any human being around because of the UVC. That's been proven by CDC, and it works. Okay, so they need to work on ventilation, being safe, installing these lights, and providing efficient disinfection techniques. Now, when you can clean with chemicals, there's a small percentage, at least 30 to 40% of the surface is not considered completely decontaminated. The reality, chemicals are chemicals, but these lights work. There's a gentleman that can give you his link. I've used them before. I've used them in my medical office. I've used them in my home. He sold several devices over to us. It works. We have these UVC lights because this is the future. At one point, we understood that our PPE was going to run low, so we have to figure out how to disinfect contaminated masks because of PPE shortage. And this is an excellent way with UVC lights.
Let's see, Dr. Hernandez. Well, one of the other things that came out this week, sir, we appreciate your take in regards to this. One of the things that came out this week, we were witnesses to a video that, went viral out there in regards to some information that some doctors were sharing. Again, I had the pleasure of speaking with Mayor Mendez, and Mayor Mendez and I were of the same thought process. After 3 minutes, I stopped watching it. Mayor Mendez stopped watching it. I felt it was a hoax, but it was shared, and it brought a lot of confusion to a lot of individuals. So, do you have some information in regards to that video, the content, and some facts instead of fiction?
Sure. I think, Frankie, let's share the video I sent you for the verify. It's about 2-3 minutes. We can go over it because This is what happens in our community when we have misinformation. It really costs. It's costly. It provides ineffective techniques, and unfortunately, people bring politics into this. They bring race. They bring in the incorrect matters, and this can affect individuals. So we can play it.
Extend it, Frankie. Extend it. There. Volume. Volume. Dr. Hernandez, would you mind sending me the video?
Sure.
And thank you. And guys, we'll wait for Dr. Hernandez to come. Again, I'm going to post the PPE that was distributed to our personnel out there. I'm sorry, guys. A friend at church gave me a better mask than that, and it cost them $1. $1, guys. So this PPE that was provided was not after that. It's a matter of changing AC filters inside units to allergen specific filters. So did you send it to my Facebook or to my?
No, to your Facebook.
Facebook. All right. Thank you, sir. Let me get in there. So you give us an introduction in regards to what we're going to see, sir.
So this is a group of frontline doctors, and first things first. I think we want people to be fighting COVID-19, and we want experts to speak, but we also want information that the non-medical community can be able to capture and utilize to counter COVID-19. Unfortunately, this video went viral, and there was some information that we feel from our medical standpoint and opinion that it's highly possible that it could be something that could be damaging to individuals.
Well, I think that's one of the biggest concerns that I've had, sir. One of the biggest concerns that I've had is that a lot of times, a lot of individuals will come out and say it's a hoax, and they're not helping the matter, And again, that is one of the reasons why I am concerned in regards to a lot of the rhetoric that is sometimes thrown out there, sir. And I have the video now. One moment, let me get in there for us real quick, okay?
Sure.
Appreciate you, sir. One moment, and here we go. Well, maybe if I put up the volume.
Online. She says there is a cure for the pandemic, so you don't need to wear a mask. This kind of story is why we have Verify, and tonight our Verify team is getting to the bottom of this. Here's Marcelina Benito.
I'm Dr. Stella Emanuel. I'm a primary care physician in Houston, Texas.
This Houston woman now in national news thanks to COVID-19 claims like this.
There is a cure for COVID. It's called Hydroxyl Chloroquine. I know people want to talk about masks. Hello? You don't need masks.
Let's tackle the first claim. Our sources, infectious disease expert Dr. Peter Hotez and the FDA.
Now we have multiple studies. Hydroxychloroquine has no proven benefit for either for the treatment or for prevention of COVID-19.
The FDA revoked emergency use of the drug to treat COVID-19 patients, citing that risks outweighed benefits of the drug and use could lead to serious cardiac adverse events. So we can verify Dr. Emanuel's claim is false. There is no cure for COVID-19. Next, Dr. Emanuel claimed you don't need masks. This, too, is flat out false. Our source here is the CDC. First CDC guidance online. Masks are a barrier to prevent respiratory droplets from traveling into the air when we cough, sneeze, or talk. That helps prevent the spread of the virus. Both of these false claims were retweeted by President Trump and his son before Twitter and Facebook deleted the doctor's video on their platform.
I thought her voice was an important voice, but I know nothing about her.
So is Dr. Emanuel a licensed doctor? Our source for this is the Texas Medical Board. Records show she has an active license with specialties in pediatrics and emergency medicine. She practices out of this clinic off Highway 6 near Katy, the same strip mall Also home to Fire Power Ministries. That's a Christian ministry run by Dr. Emmanuel. So yes, we can verify she's a real doctor. She does, however, have a history of outrageous claims, including that doctors make medicine using DNA from aliens. COVID-19 videos have been taken off social media. Dr. Emmanuel tweeted demanding Facebook repost them, threatening Jesus will take down Facebook if they don't. With your verify, I'm Marcelino Benito, KHOU 11 News.
Boy, that is some story. Well, if you see something that makes you wonder if it's true or not, we would like to hear about it. You can email your questions to verify at KHOU.
So this video went viral. Obviously, the physician is in all her right to provide her experience and opinion, just like I'm on here. And the reality is, she did mention she has treated 350 COVID-19 patients. I think the misinformation with her, she mentioned that there is a cure. Okay, let's get this straight, people. We do not have a cure. There is not a cure for COVID-19. There is investigational pharmacotherapy that's being administered, and other therapeutics like monoclonal antibodies, remdesivir at the IV in the hospitals and inpatient, convalescent plasma treatment, but there is not a cure for COVID-19, the virus that causes COVID-19, SARS-CoV-2. The second claim is that we don't need masks. This is an irresponsible claim, and I give her all the effort, and we give her props for her passion that she has. But when we speak of the virus to non-medical professionals, you can confuse someone, because now you're saying there is a cure, you don't need a mask. And so I'm actually glad that her videos were demoted and taken off Facebook. There were several individuals upset about censorship, but I think, Big Brother is watching, and they also, they can't have that information be disseminated if it can cause harm to the public, and this is harmful.
According to the CDC, doctor, they recommend face coverings, and the social distancing. What could be the reason for it that this doctor or group of doctors have been lately given that message of not wearing a face mask? Could it possibly be of the new school year coming around and they might be trying to help the president? Is that something to think about?
Well, I think, when it comes to these videos, and I look at the facts, I never bring any politics into any of this. I just focused on her because those were the clips that were shown. And I just thought, because she has the more airplay, all that information was improper. And unfortunately, a lot of people bought it. And a lot of people are sticking by that. And now, people requesting this hydroxyl chloroquine, this was a drug that at the beginning of the pandemic, the science did show that it had antiviral properties that could inhibit, and actually in vitro, in a cell culture, in the lab, it was shown that it did have antiviral properties against SARS-CoV-2, which is how all this began. Unfortunately, as time progressed into the virus, into the pandemic, the medical science started looking more into the drug, and the FDA approved an emergency use of the drug without fully evaluating the drug, and then revoked it and said, you know what, the risks outweigh the benefit. If you're taking the azithromycin, which is the antibiotic that is being used to prevent the bronchopneumonias that can develop from COVID-19 on the bacterial side as a super infection, if you combine that with hydroxychloroquine, you could have serious heart condition. So it became the fact that no longer could we use it as outpatient. And I did use the drug early on because it had great potential. But as soon as government sources say we're revoking it, we don't recommend the use, those obviously as this pandemic grows, the information grows, and the medical knowledge and the medical societies and the medical publications grow, and you start keeping up, and you start looking at what is the most effective and what is the safest for the patient. And unfortunately, this video was pushing a different agenda that could actually harm. Most people don't know, if you take hydroxychloroquine, you can develop a toxicity, and you could, if the dose is too high, you can have serious retinal an actual inflammation of your retina in your eyes and lose your vision. Okay, it's very serious. And this is a hydroxychloroquine retinopathy. It is rare, but it could happen. You could damage your eyesight forever.
Dr. Hernandez, you mentioned that you have treated individuals, patients with hydrochloroquine. How many studies have we participated pertaining to hydrochloroquine? Have you read multiple studies that maybe in contrast in belief supporting hydrochloroquine?
So very early on in the pandemic, hydroxychloroquine, basically the way it works is been shown to help with zinc. Zinc is an important ionophore against COVID-19. And so very early on, we're looking for that antiviral. We're looking for a possible drug that can have that effect to lower the virus load for our bodies to be able to fight the virus. So early on, it was something we did use as a group. We felt that there was a potential use for it to prevent someone from being hospitalized. Obviously, we've treated 2,200 individuals. And everyone is alive and safe and doing well. Not everyone got the drug. Not everyone needs medication. Not every patient is different. But as the science grows and as there's government recommendations and the FDA, we follow those guidelines, guys. So there, at this point, there is properties in the drug that prevent and fight against SARS-CoV-2. That's proven. But the risks are too high for the benefit. Now, when they looked at the studies, the New England Journal of Medicine said that they have no benefit, and if the drug has no benefit, why are you going to risk someone's life? So as it grows, as the medical knowledge grows, we tailor our treatment into this.
Doctor, is it true that eucalyptus prevents COVID-19, and how to use it?
No, I've never heard such a thing.
Yeah. Eucalyptus is also on the stands right there next to El Huevo, and right next to La Vela volteada al revés. And then you'll find the eucalyptus thing. No, guys, one of the things that I think is very important, I think Dr. Hernandez will agree, we have to do our best at these times to, maintain as healthy as possible. And by as healthy as possible, eat good foods, do some form of exercise out there, but make sure that you take things that are going to be beneficial to your body. And if the individual was asking in regards to different types of teas, I think teas are very essential, and very good as well. Dr. Hernandez, are there any other foods out there that might help an individual boost their immune system or just help them be more healthy, sir?
So I think on the vitamin side, for sure, it's proven fact that the reality is vitamin C has been proven to help fight colds. Vitamin C, 1 to 3 grams a day. Zinc is an important factor because it can inhibit, help against fight viruses and viral replication, and it actually helps drugs like hydrochloroquine come into the cell. So zinc is a very important ionophore that is used intracellularly to prevent viral replication. So all these drugs that we're looking at, we're aiming to reduce the virus so your body can come and fight and eat up the virus and you have a fighting chance. So there are other alternatives that we've used off-label, and people have done well. They've done well in Bolivia. They've done well in Peru. They've done well all over the Americas. And I personally treated nurses, physicians, other practitioners with this drug. It's called ivermectin. And with this drug, guys, it has a great safety profile. There's now a study in vitro in the cell culture that it did kill COVID-19. And now there's an in vivo study that a doctor, a physician, published in Florida, he got his health department to actually integrate it to the hospital protocol. That tells you that they're now looking at this drug it has a great safety profile and it has antiviral properties. So this is a drug that we're working with very closely. Our pharmacies here have it locally stocked, and the people that I've treated with it as a team, as a collective team, we've treated over 2,200 individuals, and these people are doing excellent, and the drug works. And you look at benefits and risks, and the drug is already FDA approved for human use for other conditions like parasitic conditions, and even able to be used in children. I had a case where I actually have a nurse that she works in the COVID unit at one of the hospitals. I have her on a nicotine patch, and I have her on ivermectin weekly, and she has not been infected. And there's been other infections in the COVID unit from workers. Why? Because I truly believe this drug is working and is doing its job, and there's actual more studies coming with it. So we're looking at what other countries have done, but it's exciting to know that we're keeping in the forefront. We're learning, we're growing, and our main goal is to fight COVID-19. Our main goal is to learn and fight COVID-19.
Dr. Hernandez, what kind of air conditioning filters for someone at home should be used at the household?
So I think the highest particulate, the highest filtration that you can get with if you can get a 3M brand that can get viruses, that's the most important one. That can pick up viruses, mold, mildew, anything that's in the air, and that's important. The AC system is always important in a home.
Exactly. Dr. Joe's comment. I'd already said that in March that was the common denominator for all our closed buildings, warship, cruise ships. Actually, cruise ships was one of the first ones I think that sounded the alarm for our community. Hospitals is the air conditioning ventilation system for sure. And I researched it, and there are pictures of coronavirus in the filters. And let me tell you, I agree with Joe. I think, again, I'm going to stick with it. I don't know if there's any proven science as of yet, Joe, but I'm going to believe that, there's something to do with them. That is why, again, no one should be, that's a good one, Fubis, but no one should be going down to campuses out there. Dr. Hernandez, one of the other things that we are dealing with in our area is the individuals that have passed away as of today. I think 400 and some individuals have tested positive in the city of Brownsville. No deaths, Dr. Hernandez. No deaths. But again, a lot of our individuals are starting to become kind of like incredulous towards the numbers, because we know for a fact that there were 22 deaths in the city of Brownsville today. So, it kind of gets into that point, sir, where, people start to feel very uneasy because they go, no pasa nada, no deaths. And then we have to understand that a lot of the individuals, sir, and look, and again, Dr. Hernandez, I apologize to you and to your staff and to Dr. Teresa Saavedra. Y'all were treated horribly by the sport. And it was embarrassing to me, sir. It was embarrassing to the AOBE Association. It was embarrassing to my community out here, sir, because they saw what they did. And let me tell you, sir, we want to hear from you, because, again, you, Dr. Saavedra, y'all are pioneers in our community. So you have the facts. You've been in the trenches. You've been fighting this before anyone else here, sir. So I want to hear from you. That's why we're ecstatic that you come on this show. So when you were going to speak before the board, we were excited. We wanted you to share with them your concerns, your data, your facts, because instead of hearing from you, Dr. Hernandez, they're hearing from those numbers that tells them that there are 0 deaths in the city of Brownsville today, sir.
Sure.
So the decisions that they make, sir, for our children, for our staff, are based on 0 when they could have been based on a hero. Dr. Hernandez. So, Dr. Hernandez, I'm concerned. The numbers have to be más o menos to where they're at, because without proper numbers, these people can't make decisions, and they're going to place our students and our teachers and staff in harm's way, sir. Would you agree?
Sure, and I think at this point everyone knows that the health department is doing the best that they can, but they have mentioned that they are behind, and so we need to be able to take that into consideration.
And before you
that's
say,
important.
and I'll give them that, and again, I understand, Dr. Saavedra explained the process, and está bien, not dogging on them, but we have to keep each other informed, Dr. Hernandez.
Sure.
And the board that is going to make these important decisions, they need you, sir. They need you to speak. They don't need to know your credentials, because they already know your credentials. They know who you are. Everyone in Brownsville knows who you are, sir. So for them to, show us your credentials, tell us your credentials, that was really uncalled for. And it was just taking away from the precious time that you could have dedicated to letting them know the danger that we're in, sir. So that is what really upsets me. I'm not dogging the county, that's fine. But that's why we have you, to share with us the numbers, to share with us the facts. And they didn't want to hear it, sir. What decision process can they make?
Yeah, it's unfortunate. When they put me on, they had me in the background. I couldn't really see, or I could only see myself, so I could barely hear any question, and it was very difficult to bring any point across. But the reality is, the infections are increasing. Children are being infected. I just had a 2-month-old, a 5-month-old, a 9-year-old, a 10-year-old, a 12-year-old, all types of teenagers, and unfortunately, those kids can bring that back home, and those kids can have serious problems. Now, we're also learning about the deaths, but no one's talking about the sequela. What happens after COVID-19? There are several people that have had multiple neurological complications. Okay, I was on the phone. I was on the phone communicating with Dr. Mario Cerdan, the neurologist that comes on your show.
Awesome,
he was. We talked about a case that I referred to him. I refer him the case because this individual was having neurological complications after COVID-19. So COVID-19, if it doesn't kill you, it could give you lifelong complications. This is not a virus you want to get. This is not a virus you want to get and become immune, because we are seeing that immunity, technically, in the people that first got it in China, there's possible concerns for reinfections and maybe an immunity between 3 to 6 months. And we're really waiting for the vaccine. I think the vaccine is going to be a game changer, and if they can make a drug that can actually prevent the virus from replicating, because ivermectin is an amazing drug, but it can be repurposed for an antiviral, and I think it's important, that anyone that gets diagnosed with COVID-19 should have this option, and I actually have. There's people that are taking prophylactically, they're being prescribed, nurses that I have on it that have been prevented from getting the virus, and they work in the COVID unit. Patients have responded well, and we're going to do everything that it takes to fight COVID-19. So if I have to look at other countries, Brazil gave out 1 million doses of this to its individuals, okay? Wow. Brazil, Peru, Colombia, a lot of these countries, they've given it out and it works. Now there's a video that I shared with Frankie, a pulmonary critical care doctor here in the United States, explains what the drug, how it works, and how the potential is to fight COVID-19. So I provide that video to Frankie, and you guys should attach it to something in regards to this viewing for after the show, because the gentleman does an amazing way to present. And this is a pulmonary critical care doctor, physician licensed in the United States using the drug. So it does work, and people need to know options. People need to know that COVID-19 is not a death sentence. There's multiple ways that we can fight the virus. Now, like, again, I can't say like Dr. Stella, that there's a cure. There is no cure for COVID-19.
No.
You need masks. You need social distancing. You need proper hygiene. You need several different things to provide countermeasures against the virus. Now, the ivermectin does have amazing antiviral properties, and we know it works against dengue, Zika, influenza, against RNA viruses. It's been recorded. The literature's there, and fortunately, our people have gotten it. Even children and adults, and everyone's alive. And we thank God that everyone is doing well.
Man.
And we'll stay on the right path.
Doctor, you
Hernandez,
have
you have mentioned nicotine patch on several occasions. Is this something you would recommend for a non-medical individual?
No, the nicotine patches. I started looking at what France was doing, and the French, they tend to smoke a lot. They're smokers, and the French, the healthcare workers were having 5 times less likely to get COVID-19 infection. So when the researchers put the science together, they realized that the virus also attaches to acetylcholine receptors in the nose, and nicotine binds to that. And when you combine to something, it can't really absorb into the body. And so when we went into the nursing homes, we did 1,900 residents and staff at the nursing homes. My staff was on nicotine patches. We knocked it out in 5 days. Glory to God. We were out of there. We had no infections, 0 infections, 1,900 tests. That's amazing. Recently, I can't disclose the nursing home that we tested, but in the last week, we tested another nursing home. 90 residents. They reached out to our medical office, and they were in need, and fortunately they were in need, and we've done it before, and we went in there and knocked it out. It took us a couple hours, and we were done. I would say maybe the positivity rate in that nursing home was anywhere from 7 to 9% out of all the tests that we did.
Doctor, going back very quickly, going back to the children that you have treated at your clinic, what can you tell us about the nurses going back to school? Would they have a harder time, treating or taking care of potential students that are potentially positive? I believe we have 1, maybe 2 nurses per campus. Should we worry about the nurses?
Sure. I mean, the children, the issue with the children is that, 80% of them are going to be asymptomatic. They almost have no symptoms, so they can potentially spread the virus very quickly. Okay. And people not know they can spread it. The children that we were more concerned about are children with neurological conditions, as we discussed, or immunocompromised issues. These are the children we're concerned about. Now, those children can infect anyone. At this point, the virus spreads like wildfire. There's a mutation on the virus now. Is more aggressive, is more infective. And so we have to be careful. So most children do not require anything but symptomatic care, for their symptoms. And it's very rare that we see a complication with a child. There was issues in New York with children having post-sequela inflammatory disorders like Kawasaki disease. And there was a Florida young girl, a 9-year-old, that died recently from COVID-19.
Yes.
So that was a scary situation because she had no underlying conditions. So COVID-19 can take your child's life if you're not taking the proper precautions.
Thank you, doctor. And just to clarify, in regards to going back to school, they are looking at 4 weeks right now. They're going to look at possibly submitting a waiver for another 4 weeks after that, to a total of 8 weeks. Now we have to remember that the start date was pushed forward to the 25th of August. With that said, the things with TEA are changing on a daily basis. Something that changes constantly. As of today, there is that word out there that TEA is going to demand that there be some form, shape of, besides distant learning, some face-to-face learning. So again, it's something that we're learning on a daily basis. So we should get more information today. With that said, Dr. Hernandez, one of the plans is, maybe September, maybe October, to start bringing in students into the campus, which again, I don't see it happening. That's just my opinion. But with that said, sir, our staff is already on campus.
Sure.
Is it safe?
So unfortunately, the board and the superintendent need to look at community spread. We've gone from family spreading to community spreading. And when there's community spread, we need to lessen the amount of exposure that people have in this community setting, specifically in communal spaces and in school. So it's important that a school district looks at the percent of community spread that we're having increase, and it's a potential for this not to open and going to distance education learning. Kudos to the people at Port Isabel ISD, Point Isabel. They went into it. They're not going to take any risk. Obviously, as you know, COVID-19 doesn't spare children or adults. It could take your life within a week. It could take your parents. And it can take the food service individual that passed. I personally knew her, was a patient of mine for years. So unfortunately, there's so many variables, and we should not go back with a question mark. We should go back with an actual device plan for every situation possible.
Doctor,
how the open up the economy has led to a surge in numbers. Could we see the same similarity if children go back to campus, since we are technically on our first wave?
Sure. So the CDC has guidance on reopening schools and education centers, and they mentioned for the school district to kind of plan out their opening in regards to parallel with community spread. If a school district opens their school system when there's high amounts of community spread, that is going to be a serious problem, not only within the school, within the community. The community becomes affected. That is the issue.
Yeah, again, what affects the school, goodness gracious, what affects the school district affects the community, especially when 50,000 individuals, have something or other to do with the district. At least 20 of them are not from Brownsville, they're from Edinburgh, but that's a different story. Dr. Hernandez, how long does the symptoms of COVID last, and do they continue as chronic sickness? Also, what does recovery look like now?
So, the COVID-19, we're seeing it cause something called post-viral fatigue syndrome. So after having the virus, individuals turn out to be very fatigued, very tired, having aches and pains, and they just feel drowned. They feel very tired, and this happens with the viruses like mononucleosis and sometimes influenza. So we are seeing high amounts of post-viral fatigue syndrome, and we're seeing neurological complications. We are seeing lots of issues with the virus causing complications, and this is something that's new as we're learning, right? So
Okay.
it's important to treat it very carefully.
Doctor, your office, just to let Sergio know, your office is located on Alton Glore and on Boca Chica as of right now. You also have an office in McAllen, is that correct?
Yes, our group is based out of our Boca Chica office in Alton Glore, and we have a tertiary office in McAllen to service that population. And we're in 2 counties at this point.
Yes. Many of our BSD employees have gotten COVID. Many have gotten it from the office. Diana, you're right. They have actually gotten COVID from the main office. I could name you individuals that have tested positive at the main office, and they have told me that they went nowhere other but to work. There are individuals, our custodians out there that are positive, the ones at Vela Middle School, Hudson, Hannah, any school out there. All of them have stated the same thing. Now, has something to do with sending them back on campus? You better believe it. My biggest concern out there, guys, is that as of right now, the school has yet to acknowledge the death of our personnel because of COVID-19. I've yet to acknowledge. And you know, Dr. Hernandez, a lot of the times when you want to keep stuff hidden is because there is a culture of corruption and a culture of non-transparency. And going back into, we just want the truth, Dr. Hernandez. That's why we're so glad when you come here, because I know for a fact that if I want some information in regards to the ventilation system, in regards to the masks out there, the proper use, I'm going to ask the expert. You know, I'm not going to ask a piece of paper that was sent down from a politician. I'm going to ask the expert. That is why it is so essential, so important for us to continue to keep each other informed in regards to the dangers, the real danger that exists. Because ¿sabe lo que pasa, Dr. Hernandez, is that what happened the 4th of July, what happened in Memorial Weekend is something that we're going to see again. Labor Day.
Sure.
We're going to see Halloween. Can you imagine Halloween in the city of Brownsville during coronavirus, sir?
Yeah, no, it's a grueling picture, and we have to come together as a community to fight COVID-19, and we all need to be, and at the end of the day, we all need to be working together, okay, and sharing our information to help each other. But the school district really needs to open up and bring in. They need to bring in local experts and figure out what is the best way to mitigate the disease because of the population bases that they have. 50,000 individuals is important, and how they handle it.
Doctor, going to school, is it possible that the schools could somehow, either through block scheduling or A and B schedule, is it possible for them to mitigate the interactions and, you know, fulfill the guidelines of CDC of the social distancing at our campuses? Is that possible?
That's attainable. The CDC has produced guidelines for administrators, and that's one of the mitigating factors that they recommend doing cohorts where people are staggered, and that works. But the reality is that only works when community spread is low. Our community spread is through the roof. Not until we have a true containment of the virus can we move into these type of functions.
Dr. Hernandez, are face masks with PM 2.5 activated carbon filters good to wear? Yes.
You know, this carbon mask do not filter many viruses. I recommend people get none of this.
Dr. Hernandez, one of the concerns of a lot of individuals out there is, you know, we recently went through a hurricane. Well, we went through a lot of rain here in the city of Brownsville. But that brings us to the fact that, you know, after rain here in the city of Brownsville, after a lot of flooding, we start to get mosquitoes. And after mosquitoes, you know, we're at that point in time where flu season starts to come in. Are you concerned, Dr. Hernandez, with all the other different illnesses that come with at about this time, such as maybe mosquito-borne illnesses, the flu, and how do they affect individuals who are fighting coronavirus? Does it compile? What's your take on it?
So when you look at guidance, guys, coronavirus patients could have up to 21% of co-infections with viruses like parainfluenza, influenza, and other coronaviruses that are they're not novel, and so there is co-infections. Okay, so someone can have COVID-19. I had a patient that tested positive for COVID-19 and tested positive for the flu at the same time.
Wow,
they have both things. They survived. The reality is it's important to know that these co-infections exist, and those people with co-infections, if you have flu H1N1 and if you have coronavirus, you're at higher chance of death because people do still die from the flu, and people are dying for COVID-19. So there are higher risks. And the reality is, with those viruses, we do have antivirals. Okay, we do have antivirals. With COVID-19, we don't have a cure. We don't have an antiviral. We don't have vaccines. We don't have herd immunity. We're pretty much you're gonna get into an issue potential if you get COVID-19. So Even though 80% of individuals do well, but guess why we're one of the worst cities and counties in Hidalgo and in Cameron in regards to death and infections in the United States at the moment as we speak, because our people here have high risk of comorbid issues like diabetes and obesity, which is rampant here, and that's why we have more deaths, and we're going to continue having more deaths. I've had people that I learned about pass from COVID-19 just because they're considered obesity. There's no other risk factor.
Not me.
There's no other risk
Not,
factor.
'cause I'm handsome and totally not fat. Doctor, risk factor in attending a family's member's rosary funeral during the pandemic. I know that what's one of the concerns. I know that our funeral homes here in the city of Brownsville, most of them have done an amazing job in regards to protecting the families and doing their best to make other individuals adhere to certain guidelines and recommendations, sir. But is there a risk factor for family members attending these events?
So it is considered a risk factor because of the ventilation and the grouping of people. I have spoken to multiple people that tested positive after visiting a funeral. Okay, that's an important thing that people need to watch out for when you go to a funeral, that you practice the distancing and really keep, because you're in a close environment, right? And you're rebreathing all that air. Ventilation system becomes a problem. But I have spoken to individuals that got infected at a funeral.
Doctor, the last time you were on with us, you had mentioned that we are in a tsunami. A couple weeks ago, the city of Brownsville released the matrix categorizing our city at a stage 4. Do you think right now, based on your experience handling these cases, that the city of Brownsville is at a stage 5?
I think the city of Brownsville has been very proactive. They added 2 sites, one on the one at the Port Clinic. They added that site, and then they added another site of a doctor's hospital. So now they have 3 locations. They're able to test quickly, and I think as a city, they've been mitigating the disease well. So it's important to understand that that's being distributed out, and people have different numbers. Now we believe that we are not. I don't really believe we're out of the tsunami, but we're doing much better in the sense of new cases. New cases have been growing, but at the end of the day, we're also backlogged. So really, our tsunami was maybe 3 weeks ago that we're barely seeing those cases now. And we'll be talking about these numbers in a month from now, is what's happening now.
So, Dr. Hernandez, do you project that we're going to soon start to go down in regards to all these positive numbers? It seems like here in the city of Brownsville, sir, they've been increasing. We went from Mayor Trey Mendez, did let us know that for the next 10 days, we were going to have triple-digit numbers in the city of Brownsville. That was 2 weeks ago. So we passed the 10 days for Mayor Mendez. We were at like 120, 140. We went up to 200. We went up to 300. We're over 400 now. Positive in the city of Brownsville. Do you sense that we're going to continue to rise? We're going to plateau soon, or we're going to start to dip anytime soon?
So I think really we need to see how the next week turns out. Next week is important to know that reality. But that those numbers, we knew when we were working, almost 24/7. And with all those positives that, finally it was going to come out of how serious it was. And a lot of people say that we were doing fear mongering, scaring folks and all types of issues. All we're trying to do, guys, is educate the public.
Yes.
We're not experts by training. We're experts, local experts by rule of thumb. We began fighting COVID from all angles, and so we learned a lot about the virus, how it acts, how it infects individuals, how we combat it, and I think we've been successful in helping the community and the hospitals not get overflown with these cases.
A double layer 100% cotton mask with surgical mask as filter in between the cotton layers and face shields. Is that good enough, or should we buy a respirator mask?
No, the most important thing, if you want full protection, you need an N95 that's fitted for yourself or a P100 respirator. As long as you practice the distance, if you're wearing these type of masks, I believe they're putting some carbon filters that helps. But all these needs to be tested. So whenever you buy an item, it's got to be certified by that NIOCA-SH, and that is certified, right? And it's an item that has been proven to prevent the virus spread.
Jorge Espinosa has a question in regards to dining in. Whataburger closed their dining areas. Do you think that all dining restaurants should be closed?
That's a hard one. I think Whataburger is open for dining.
No, they closed. They closed recently.
They were. Yes, they were. So that means that they had infections.
Well, I think that one of the things that has happened is I know because I go eat a lot, and Whataburger, I don't know if y'all know, is one of my favorite spots. Not only to fall asleep, but also to eat. And I actually went I think yesterday, and they did inform me that throughout the valley, the Whataburgers had decided. This is what the manager told me, had decided to close the dining room area because of the severity. So it's a valley-wide thing. One of the things is that as of right now in the city of Brownsville, the dine-in area shouldn't be more than 25% capacity, which really doesn't make a lot of sense for a lot of businesses because of their overhead. So that's not good business. So I guess the question is, do you think that we should go back into a zero dine-in and just continue to do the curbside?
It's unfortunate for small businesses and restaurants, but at this point, it's very important for our health and safety. And so 25%, I think is important to see how it works and give it 2 weeks, because the city's following the numbers, right? And they're looking at the trends. They're looking where the infections are at. They have viral mapping. The city is very advanced. City of Brownsville is advanced. We do provide all of our numbers to them, and they have internal logistics teams that provide these type of maps. And Mayor Mendez has been very active. And very active, and so the commission's active. They make different requests, and it's all for the benefit of the community. So when they had other testing centers come up, that was something that I had been saying. Other people need to step up. Other people need to come up, and other people need to help.
Hey man, let me say very quick, just to answer Jesus' question. Many people are planning their funerals and wills. If you have COVID and pass, can you be buried, or will you need to be cremated? I will let you know that I have spoken with a lot of funeral homes, and they are respecting a lot of the previous wishes of a lot of individuals. The issue is that it's going to be done a different way, and that's what people need to be very, very patient with. They are not preparing the bodies. It's a quick, if it's a burial, they're in the freezer. And it's a quick boom, 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 and the individual is buried. What would happen a lot of times, a lot of individuals, they last here like 4 or 5 days. So family members came, blah, 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 blah. That's not the case.
Wow.
We are different types. The preferred method is cremation, just because it's very quick and it's very, it's a done deal. Let me say something very quickly in regards to wills. Guys, we will be having a wills clinic.
Wow.
In August, 2 consecutive Saturdays of August, we will be providing, thank you to our amazing attorneys here locally in the city of Brownsville. Thank you. Thank you, thank you, thank you. They have seen a need. My BISD family, please stay tuned. We will be sharing out the questionnaire in regards that's going to be needed. We are going to have 2 full Saturdays in August, consecutive Saturdays, where will we be having a wills clinic. And by that means that we will be, our attorneys will be, I will be promoting. Our attorneys will be out there providing wills to our people. Wills. And guys, I mean, I know a lot of my friends out here have said, guys, I've done my will. I think a lot of individuals have said it here on the show. Guys, we will be providing that service here in the city of Brownsville 2 Saturdays out of the month of August, will clinics. So please, I will have more information on that this coming Monday. I will have a meeting with my attorneys, and we will be producing. Again, guys, one of the things that I love about this community is, and I love about my attorneys, I love my attorneys. I have the best attorneys in the world, and they're always giving back to the community, always giving back to the community, and that's what it's all about for guys. You know, they see a need, and they see where they can use their expertise to help. So they're going to be providing their legal counsel in will preparation to assist my folk out there. So, guys, please be on the lookout, and please do not, be patient with me. Please don't bombard my inbox with Erasmo. What about the wills? What about the wills? What about the wills? Because I'll be reading them all night. Again, I put up a post. Be patient. On Monday, I'll have more information, and that's a great service, Dr. Hernandez. People should look into these things. Start preparing their wills. You just never know. It goes sometimes very, very fast, sir. Is that correct?
Yeah, it goes fast, and it's an unfortunate, unprecedented time that we have to be discussing, deaths and wills. That's something new, but the reality is our harsh reality. COVID-19 is our harsh reality right now, and all we want is to have an effective vaccine. We want to come back to normality, but we all need to fight this together. And so once when the community fights. The school district fights, PUB fights, the city fights. Everyone does their own mitigating factors. One thing that I've started hearing more and more and this is the mentality we should stop having is, well, we're all going to get COVID-19 at one point. This is not the mentality that we should have. And this has been multiple people that have mentioned, we're all going to get it. Well, guess what? If you get it, you might be that small fraction of a percent that could die from COVID-19. Why risk it? Follow all the guidelines, follow the recommendations, wear your mask. Don't take hydroxyl chloroquine. It can, when it's not prescribed by a medical practitioner, can damage your eyes, can give you toxic effects, can give you cardiac issues. And don't look at the facts. And trust me, now our medical community is very involved in testing and opening up their offices. We just made we have a new announcement at Erasmo. Starting on Monday, we'll start a mini drive-through clinic at our Boca Chica locations from 5 to midnight. There's a lot of individuals that are working. And when it comes, we finish at the sports park at 4 or 5 p.m. and people getting out of work at 5. And so what if they start feeling symptoms? So I will have access to rapid antibody testing, which that is recommended in some times and not. But for active infections, we're looking at the PCR that we're potentially we're doing. And also we're going to have access to a rapid antigen test where I can diagnose COVID-19 through screening of COVID-19 in 15 minutes. So we will be starting that. I'll be providing you the website for that. Good. We'll be starting that Monday because there's a lot of folks that are trying to get into an appointment, and we've already closed down because our city merit is until 5 p.m. Fortunately, we're in urgent care. We're open 7 days a week, and so that's a need. Also, we will function as a retesting location. It's unfortunate that employers do not want to follow CDC guidance. CDC guidance states you do not need to retest, okay? But some employers are forcing individuals to have that negative paper, and people can lose their people have called us, if we don't retest, we can lose our job. And so we're going to reopen for a mini drive-through at our Boca Chica location for retesting when an employer is part of the internal policy, because they should not be requiring people to retest. But some employers have internal protocols, and if they require it, then that individual needs to get it if they fall under that umbrella. So we'll be able to test at night. It's going to be between 5 and midnight. Okay.
Awesome.
And we're gonna have rapid testing, and we're gonna have PCR testing, and that starts on Monday. We made a decision because there was just a need in the evenings. There's a large need I'm here working from home with our telemedicine component of the practice, but there is a need for testing. I mean, not everyone that tests between 8 and 5, people have COVID-19 and after 5. So it's an important thing that we're going to be offering.
Well, I appreciate, Doctor, and please send us that information so that I'll be out there promoting and letting our individuals know on a daily basis, because it's very important, guys. It's very important. Linda, my friend Linda, has a question in regards to diabetes. Diabetic recover from a COVID at home.
Sure. So I've treated many diabetics with COVID-19, guys. Not because you have diabetes means that you're gonna have a complication or you're gonna have death. So diabetics do recover; they recover at home. And what I do for diabetics, some that are not doing, they have their A1C controlled or not doing very bad. I sometimes I increase their dose of their medication and I put them on a steroid. This steroid called dexamethasone has helped prevent the inflammatory component of the disease, and that inflammation affects how the oxygen is filtered or passing through the bloodstream into the hemoglobin, which is why people's oxygen level decreases. So the inflammation is key. If we can keep the inflammation down, people's oxygen saturation stays high, and it prevents them from going to the ER or having these complications. So we do treat diabetics, and we treat them aggressively because they can have more issues than a regular individual.
Doctor, pre-COVID, the student-to-teacher ratio was anywhere from 18 to 22, 24. Looking forward, what's your recommendation of the student-to-teacher ratio?
6 to 10. I think, no more than 10. I think, 8, 6 to 8 students and the teacher. I mean, we're in these times where it's a pandemic, and we have to continue following the guidelines, and CDC recommends no gatherings more than 10 individuals. So we need to follow that everywhere that we can.
Doctor, and just Ronnie's specific question, what recommendations can you give if teachers are to return to classroom with a small number of students?
The recommendations are going to be is the reality is you need to treat everyone as they're infectious. Wear your mask, common courtesy, wear your mask, and keep your social distancing, frequent hand washing, and obviously notify whoever you need to notify if anyone's having signs or symptoms. They should not be in that same facility or same classroom. They need to be moved out, and they need to be assessed by the nurse and possibly tested as soon as possible. So it's something that we're willing to do for BISD. We can offer testing to them. The reality is COVID-19 is everywhere, and we need to fight it on a daily basis.
And this is something that we've seen a lot here in the city of Brownsville, also in Hidalgo. Are the fumes from cremation? Is there anything tested out there that declare them to be unsafe to our community?
No, I don't have any research on that topic. But when something is cremated, is completely incinerated, and so when you get to up to 400 degrees, it becomes sterilized. So I don't believe this is any issue.
No, I think we're going to be okay. I think there's a lot of once everything is burned, I think it's done with. Those who have had COVID-19, can they get sick again after having it, and can they have some of the syndromes again after having them? And this is after they've tested negative. And we do know that some doctor, actually a doctor from here from the Valley, tested negative, retested positive. I mean, are individuals that had it before in danger of possibly getting it again?
So there's the immunity concern that we're hearing concerns of reinfections, and so China, started in Wuhan in December. So I think there's studies that is monitoring those individuals. They're checking their blood levels of the antibodies over time, and so they are seeing that 6 months out from when they got the virus, their antibodies levels have decreased to make them not immune. So could you get COVID-19 again? I believe you can.
Doctor,
we've had it, It's been proven that individuals that have had it before can get it again.
So the issue becomes the PCR testing is specific for COVID-19, but any other testing, like for example, a lot of people are trying to get antibody testing. So there's cross reactivity because there are coronaviruses that are common to humans that we've had before. They cause common colds. So then that can be confused with a reinfection. So a true reinfection is proven by the PCR polymerase chain reaction that you are positive for COVID-19. Again, you have a viral RNA in your body. That is a problem. So I do believe that people could have the reality is a reinfection.
Doctor, we have seen how sports athletes, in particular the Florida Marlins, they've tested positive and they kind of shut them down. Is there any way that either UIL or BISD could test the students to try and prevent any positive athlete from participating? Is it possible?
Sure. I think, if they should not have any contact sports. They should not have any contact sports where perspiration and close contact with individuals. I think they were mentioning volleyball. I think that could be acceptable. But remember the fact that contact sports can cause this issue, can cause exposure. So if anyone's going to enter into a rigorous UIL competition, they should be having frequent testing.
Well, let me tell you, Doctor, that one of the things that we experienced this week, besides UIL and a lot of these board members and superintendent, is they're planning on bringing our students back to participate in sports. They've already came out with some guidelines. But the other thing that happened, Dr. Hernandez, is Major League Baseball started last week or this week, can't remember. And the first day, the Marlins had to cancel because of COVID-19. Sir, if Major League Baseball with millionaires playing a game where there's no members in attendance who get tested regularly and protected and encased and blah, 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 if they can test positive,
anyone can.
What's the guarantee that our students playing baseball, football, soccer, volleyball, not golf because golf is not a sport, but any other sport out there?
I mean, it's not recommended. I don't think they should be focused on any sports.
Not right now.
Yeah, no, they shouldn't be focused on any sports right now. They need to be focused on mitigating the spread of the virus.
Doctor, in your professional opinion, and you've said it before, but again, everything changes. In your professional opinion, when would be a good time to talk about bringing our students, our teachers back onto campus?
The only way we are going to focus on this is we need the school board to engage with the local professionals, okay?
Amen.
And engage with the health department, specifically the Brownsville Health Department, because the Brownsville Health Department is up to date with what we're doing, okay? They get all the information from us, and that's disseminated to them because that's the way we have that arrangement between our private entities and the city of Brownsville. And then they know the numbers, they know the mapping, they know where the infections are at, they know what needs to be done. So when we have a control of the community spread, then we can have discussions about people going back to school, staff and children, but not till we flatten the curve and get rid of the community spread as much as possible. Now, a game changer would be having a vaccine in December, which is being the U.S. has prepaid 500 million doses of a vaccine already. The U.S. government has prepaid 500 million doses of a vaccine that's going into a phase 3 trial. So this is highly likely that it's going to be available, if successful and considered safe at phase 3 by the end of December. The vaccine will be a game changer.
Doctor, what is the process and the cost of retest at your clinic, sir?
So retesting is something that we don't encourage employers to focus on retesting but we do understand that there's individuals that could lose their actual jobs. And because of that, we do have a process for retesting. They can call the office at 956-546-2000 and 956-518-7444. And that's how we're going to function with that reality. No, we don't want to retest, but if it's necessary, we will do it. And we were going to have appointments to that. There's going to be there's obviously a cash price, and insurance does cover their test. So it's something that is very new to us.
Zinc, vitamin C, magnesium, calcium can really help someone recover or prevent from COVID. Yes.
Zinc is important because it works for viral replication. Vitamin C, those are all important.
Doctor, what's your message, to the public? I've heard from people saying, "Oh, you're negative. Talk about the positive." What should we be hopeful for moving forward, dealing with this COVID-19 crisis?
I think the hope, first of all, our hope is that our hope is in Christ. That's how I get my strength every day. Besides that, we focus on science and numbers, and the science is showing that we are progressing into 6 competitors with a possible vaccine for COVID-19. The vaccine would be a game changer. There's also, if you go to the FDA website and the NIH, there's many pharmaceutical companies that are focused on providing an antiviral drug that directly affects the replication of COVID-19. Once we have a combination of a vaccine and an antiviral drug, we will do very good as a community and as a human race, because this is affecting the human race.
Well, Dr. Hernandez, again, we are at an hour and a half, sir. Again, your time is very, very valuable, and we appreciate the time that you dedicate to our community, not only here at this hour and a half, but, again, you're a pioneer, man. You're one of the first individuals out there, if not the first in the city of Brownsville. You have been fighting it for the benefit of our community, sir, and, we appreciate everything you do. But, sir, any last words, any last recommendations for the people?
No, I think we continue the fight. Do not get discouraged. There are positive changes coming. There are positive. There's so many forefronts out there that we're fighting COVID-19. Everyone take their own measures. If possible, follow the guidance. It's unfortunate that the people that go on ventilators are passing away at high rates here in Brownsville. Okay, so you need to understand that if the ventilator death rate is 30% in the nation, we're probably going to be at a 50% because of all the comorbid issues that people are having. So it's important. David Smith, I'm actually excited about him talking about the Forge study. I know he's talking about Hydroxyl Chloroquine, but he is correct. They found little to no side effects. The reality is we need to look at the New England Journal of Medicine. And there's no benefit at this point. There's more risk, more cardiac risk and other risks. The drug does have antiviral properties, but it's too. We need to follow the government has the interest of the individual and also the medical community. Do you believe the medical community, as passionate as they are in this town, will be withholding a life-saving medication to individuals? Is that something that can cross your mind? Yeah, I truly don't believe that anyone here would withhold a proper treatment or a cure, to anyone. So let's focus on moving forward and providing the proper medical guidance for people that are positive.
I appreciate that. And to everyone out there, I'm not skipping your questions. Sometimes when questions come in rapidly, sometimes I'll skip one. But please, I don't want anyone out there to think that we're skipping your questions. I am not. Y'all should know me better than that. I love questions. The truth of it, the matter is that sometimes we are overburdened with questions. But I appreciate David's question. I appreciate David, letting me know that I had skipped over the question. It's not done on purpose. So anyone out there, if your question didn't show up, please remind towards the end when it starts to get a little bit slower, and we'll do our best to answer your questions. Again, we don't want to skip anyone's questions. I promise you. It's not my style. It's not me. Would it be good if the city of Brownsville starts fumigating the streets? Yes. And Dr. Mayor Mendez mentioned that they had already started, Ramiro. So if they haven't down your way, please. Frankie, last words.
BISD should be listening to the medical experts. It's unfortunate that, other school districts have brought in Dr. Hernandez for him to give them advice on how they should move forward. It's very alarming when we see pictures such as the special services offices with shower curtains. They expect for our staff to feel safe. It's very alarming because our teachers that deal with special needs students, they're not as lucky. They have carpets in their rooms, which, they don't clean as often. And the students, it could be hazardous for the students because they lay down on them, they crawl on them. It's very scary when our school district is so adamant on going back to school after these 4 weeks of distant learning. Again, we have our special needs population that they bite, they scratch, they kick, they punch. Our teachers, we won't be able to practice the social distancing with them. So are we throwing our teachers, our students in the lion's den? I believe so. I've been an advocate for home-based learning to work with parents. I think we should get away from forcing our teachers, our students back into the brick and mortars. I'm glad we have someone like Dr. Eder Hernandez who comes on regularly to advise us, hey, the numbers, are very alarming. It's very real. Death is at our doorstep, but BISD is so adamant on coming back. It's very scary. Together as a community, we have a chance to bring the change we need. Hopefully we'll have individuals in office that will listen to our doctors, such as Dr. Eder Hernandez, Dr. Mario Cerdan, Dr. Teresa Saverda, Dr. Zamir, who have come on and told us, be cautious. This virus is deadly. Thank you so much, Dr. Hernandez, for your time, sir. It's always a pleasure. It's always great to have you on, sir. Whenever you're free, let us know. You're always more than welcome. Thank you for your patience, guys. Tomorrow morning, 9 a.m. in the morning, guys. Thank you so much.
Bye-bye. Thank you, team. Yes, sir.
Dr. Hernandez, a quick question, just because I get this question a lot. In regards to O positive, is there any new information in regards to O positive?
It has to do, there is some studies, there is an important message there with the way the oxygen cleaves into the hemoglobin for the saturation and the blood type. There's specific blood type that it is more prone to having lower oxygenation levels. But I'm going to provide you guys the studies so you guys can look at those. But that is common. That's a common question, and I think the O positive is the one that people need to focus on.
Guys, and I'm sorry that we didn't have enough time to focus on to give more information in regards to the Sylvia Atkinson trial today, hearing today. I promise you tomorrow at 9 o'clock in the morning, I will give you an update in regards to what happened. I will give you an update, so stay tuned. I will give you an update in regards to what I think is going on. And again, I'll be very, very honest and very, very frank. Again, I did believe that today was going to be where her bail bond was going to be revoked because of her continued disobedience to the federal judge. I was at 70 to 80% sure that that's what was going to happen. But again, something other happened. Guys, one thing that I want you to completely understand, there are things happening that we are not privy to. We do not know, but we can speculate a lot. And that's where I think a lot of the problems come in. Guys, please don't be out there listening to people and think, oh, she's going to get off. Nothing's going to happen. She's going to buy up the feds. No, it's not going to pay off the feds. She's not going to walk. She is going to fry. And tomorrow I will give you a reasoning why I think that is the case. I'm making cheese crisps right now. Be careful with the timing, guys. A lot of times, que no quede muy negro porque se quema un poquito. Let me know, JJ. Send me an inbox. Guys, stay safe out there. Please continue to be good to each other. Please be watching out for each other's well-being. I'll have more information in regards to the Wills Clinic. Dr. Hernandez is amazing. He should be heard. He should be heard, and he should, be listened to. Guys, please be good to each other, and please be good to me. Bye.